I'm Tracey Garner. I'm the Health Services Supervisor for the West Ada School District. I am super excited to start and kick off our third year with Project Echo, providing education for school nurses and school nurses in rural Idaho. I just feel blessed that Project Echo is providing these great educational opportunities for school nurses. And thank you, Jocelyn, for all the great work you've done the last couple of years. So really excited today to talk about effective care coordination and health plan communication. I think it's one of those items that as school nurses, we can do a little bit of a better job with coordinating with multiple team members. And so we're going to talk about that. Learning objectives today. Next slide, Jocelyn. We're going to talk about understanding the care coordination within the school nursing scope and standards of practice. And we're going to use the NASN school nursing framework for that. By the end of this, you should be able to articulate the school nurse role in collaboration with community health partners to develop specific health plans for individual students, focusing on removing that health barrier and advancing academic success. It's all about the individual when we start to talk about collaboration with community health partners. And then as well, you'll be able to articulate the school nurse role in collaboration and coordination of overall health and learning and kind of the system process. Next slide. School nursing care and practice occurs in the pre-K through 12th educational setting, functioning as the solo healthcare provider or practitioner, rarely with physician oversight, integrating health and education laws, regulations, and policies with the goal to advance student educational success. Again, we talk a lot about as nurses and healthcare practitioners, we function in environments where the mission is to advance the health and wellness of our patients. When we are working in the school setting, our primary goal and mission is to advance student educational success. And we do that through removing the health barrier. We don't become the health barrier. So focusing or looking next slide, at the framework for nursing practice. There are 5 key framework principles: care coordination, which we're going to talk about and delve into deeper today, leadership, quality improvement, public and community health, which Dr. Womack's going to touch on with measles and do some question and answers. I hope everybody watched the presentation put together by Dr. Womack and Dr. Hahn. It was awesome. So if you haven't, make sure you do it and stick around for the question and answers. It's going to be awesome. And then encircling our 4 standards of nursing practice that we just talked about is the 5th, which is the standards of practice. And these are our foundational evidence-based, clinically competent, quality care nursing practice in the school environment. So an example of how you use this is when you go to Snowy or right now with Project Echo and you're receiving education about students' diagnoses that you might see in the school setting, you are getting standards of practice. These are the common standards that we should be using that are based in evidence-based, clinically competent care. Care coordination is going to start to talk about using those standards of practice for those particular medical conditions or disease for the individual student in the school setting and their school setting and what that looks like. And so it's drilling down into the individual students. Next slide talks a little bit further about each of the school nursing practice framework standards and gives you a little bit more detail in each of them. And you'll start to see when you look at these bullets that standard of practice is really about setting up systems. How are we going to take care of students with diabetes and making sure that we're applying the same standard of how we do that across the board? Care coordination, again, goes down and delves into that individual student in their particular setting and coordinating that care, so we're removing that health barrier for that kiddo. The school nursing practice framework is aligned with the whole school, whole community, whole child model that a lot of us are familiar with in the educational world, that calls for the collaborative approach to learning and health. It's defined by the ASCD and CDC. ASCD, for those of you that don't know, is the global community that's dedicated to excellence in learning, teaching, and leading. And the Centers for Disease Control and Prevention encourages the use of this ASCD global model framework for improving student learning and health in schools. On this slide, also with the bulleted practice components, you'll further see the interplay and difference between standards of care and our standards of practice and care coordination. Again, I can't emphasize it enough, and so I'll keep saying it and repeating myself. Standards of practice are about system process, procedures, statements for clinical guidance, versus care coordination is going to be more about your specific individual students. And it also, with care coordination, emphasizes, and one of the things that we can get better at that coordination between medical providers, educational providers, and parents, and how the school nurse really is at the center of that, and is it their role to facilitate that care coordination. Next slide. So at the center of our framework for nursing practice is students. And our goal is that students are healthy, safe, and ready to learn. I apologize about the blurriness of the slide. I do my best. Not my area of expertise is technology, but it is the center of our framework for nursing practice is the student. And again, students are healthy, safe, and ready to learn. As you're looking in your individual schools and districts, you should have your own mission and vision aligning with students healthy, safe, and ready to learn. And you could actually adopt that as we do here at West Ada. That is our health department mission, is to have students healthy, safe, and ready to learn. Students at the center of the school nursing practice, surrounded and supported by relationships and connections with families and schools, communities, allows the daily use of nurses' skills outlined in the practice component of each principle to make sure that our students are healthy, safe, and ready to learn. I hope a lot of you have the NASN school nursing scope and standards of practice. It is excellent in defining what we do. If you don't have it, put a comment in the comment section, and let me make sure, especially those of you in rural Idaho, that I'm getting you a copy of that. It's so beneficial and helpful to what we do in school nursing. Next slide. I think we're on slide 8. Jocelyn, I'm not seeing the slides right now. That's my end. So just making sure we're together.
Yep, framework visible.
Yes, so this is the standards 5A, coordination of care competencies. So the standards tend to be these standards, these first group we'll go through tend to be student specific. The next step will be system, but the standards talk about coordination of care and the competencies. And there's 18 standards of practice that we're required as school nurses to be proficient in. And let me look really quick. I want to show you. Sorry, I just was trying to find something. The standards The 18 standards, the first 5 standards of practice of the 18 standards in the framework principle of care coordination align with our 5 steps of the nursing process: assessment, diagnosis, outcome identification, planning, and implementation. When you get to implementation, the 5th standard of the 18, under it, you will find standard 5A, which is coordination of care. I kind of jumped ahead, Jocelyn. Now I'm on 8. So if you look at these standards, and we should go through these because this is about care coordination, 5A1 says we coordinate creation and implementation of plans. We provide care coordination among all members of the student interprofessional educational team and healthcare teams, including parents and guardians. We also have the parental rights bills now that also guide some of that collaboration and inclusion of parents. Remember that interprofessional teams are groups of healthcare professionals from different fields who will collaborate to deliver high quality care to students. The team consists of the student's physician, pharmacist, therapist, social workers, and other disciplines, with the goal to integrate the diverse skill and perspectives to address that student's complex needs effectively. 5A3 manages the student care and promotes developmentally appropriate independence to reach mutually agreed upon student-centered outcomes, communicates with student, family, stakeholders, and that interprofessional team, which includes educational members, with community-based resources to effectively safe transitions in continuity of care. So talking about safe transitions, we have transitions from pre-K to kindergarten. We have transitions amongst levels depending on the size of your schools and whether you have elementary, middle, or high. You also have transitions from inpatient or long-term community care back into the school setting. Nurses should be at the center of those transitions back into the school environment, especially when a student's coming from inpatient. We do a great job, and our schools do a great job of ensuring that we're involved when it's a medical condition. But when it's mental health, we have equally as it's equally important that we're involved in that transition back into the school environment as the student with the medical condition. So just make sure that your school educational team knows that regardless of the inpatient care, it's really important that nurses be included and involved in that transition meeting. Studies show, the reason why studies show that the interprofessional collaboration will lead to better student outcomes, streamlined processes, and then we all have a higher job satisfaction when we're all working together and seeing the outcome of a very difficult student turn out positively. The way we do that, again, is a lot of collaboration with our community partners. One of the reasons Dr. Womack and Casey are here, Noreen and Casey are with us, is they value the collaboration and the input that we provide as school nurses. And they're here to show you that by being part of these educational sessions, and then are here to also help us with any of their fellow professionals as to the value that we bring to the table when we're with kids 5 days a week, 6.5 hours a day, every day, all day. We have so much assessment and data that can be really valuable for our community partners and physicians in directing student care. 5A6, we're developing teams that are developing plans that are student-centered. We're documenting that coordination of care. It's really important that we're documenting those conversations with our interdisciplinary team for continuity of care, so the next person that comes in can see what's going on. And then we get this great individualized healthcare plan. that takes into account the student's educational day and school-sponsored activities. So those kiddos that are attending activities, those kiddos that are going on field trips, they all should be able to, and those kiddos that play sports. We want to make sure that their individualized healthcare plan addresses those specific needs they may have, so that, again, they can be attending those activities and the healthcare barrier or the medical barrier has been removed. Next slide. I have it as 9, coordination of care competencies. These are the 5A, 9A, 5A, 10A, and 5A, 11A. These are like your system competencies. When you look at NASN, it says for those that hold a master's, they will do these higher level coordination of care. I'm sorry, any of us, regardless of the education, diploma, associates, bachelor's, master's, can do and effectively do coordination of care at the higher level in the school setting, managing those identified populations with specific needs, coordinating that education and healthcare system and community resources, and then synthesizing data and information to identify the gaps in services and supports, and looking at how we're going to modify that school environment to lessen those gaps. Next slide, code of ethics. Again, just recapping, we're going through the NASN school nursing scope and standards of practice in all the areas that cover care coordination. We've talked about the standards of practice. We've talked about specifically care coordination. You also have your code of ethics in school nursing and your provisions. And within those provisions, there are 9 provisions. You get into detail about the collaboration expectations and collaboration and communication with our community partners. So I just grabbed some snippets out of each of those provisions in the Code of Ethics for us. For example, Provision 1 says that we will collaborate with our educational colleagues to facilitate student health planning with the classroom in mind. Again, it's always about promoting academic success and furthering academics with individual students. What else did I want to talk about? Provision 3, again, talks about ensuring that school nurses are supporting and a part of those transitions and planning to help students navigate those transitions, and it talks about inpatient to school. Next slide. Provision 4, again, the nurse has the authority, accountability, and responsibility for nursing practice and takes actions consistent with the obligation to promote health and provide optimal student care. You must understand your standards of practice. That's where, oh my gosh, again, a great service this summer was when Cindy put together, and a number of you attended, the back to school training and coordination with St. Luke's about specific skills for nurses. And one of the things that came up was the replacement of the G-tube. And the presenter, the nurse that did the presentation, it was awesome. And she reinforced, without even realizing, that it's really important for school nurses to know what those standards of practice are. And just because they're asked or what they believe told to do something, they need to make sure that they have the necessary prerequisite skills, knowledge, and experience to be able to do those tasks. For example, one of the items that we talked about was replacing a G-tube and when it's appropriate and when it's not. Provision 5, school nurses are lifelong learners. And then Provision 6, school nurses have a positive impact on the quality of care via collaborative decisions and implementing those professional standards in the educational environment. Next slide, again, goes on to Provisions 7, 8, and 9. talking about the role of school nurses in care coordination and how valuable and important it is to developing not only health programs, but individualized plans of care and interventions. That we are collaborating with other providers to reduce health disparities in the educational setting, and that we're engaged in our professional associations such as NASN and SNOWA to allow the school nurse to work collaboratively to ensure evidence-based practice focused on student education. So you're just hearing it over and over and over again. The expectations of school nurses through NASN in the scope and standards of practice is that we are communicating regarding individual students and their health plans and needs, making sure that we're all on the same page. And so just because we have really good, and we've been working the last couple of years on understanding our role in developing those standards of practice from a system perspective, now we got to start drilling down and making sure we're as equally proficient in these standards and that we're following this care coordination model that's been really effectively laid out for us. So school nurses, next slide. School nurses must have the skills to communicate within both the healthcare and educational arenas and the requisite knowledge and skills to interpret applicable laws, regulations, and professional standards. Again, just directly quoted out in Essence Scope and Standards of Practice. I encourage you, I know how uncomfortable it is. Trust me, it's uncomfortable for me. Daily, I put myself in scenarios in the educational world to learn and gain more knowledge so that I can bring to the table my understanding of what I know as the role of a nurse to help improve students' success in the educational world and advance their academics. You have to put yourself in the educational world. You just can't sit in your health office and tend to, that the walk-in traffic or daily illness. We have to get out there and share and make sure that we're removing that healthcare barrier for these kiddos. And you will start to see changes. We're starting to see marked improvements in academic achievement at West Ada through everybody, nurses, educational staff, rowing in the same direction with intentional scheduling. When are we scheduling those blood glucoses? When are we scheduling our treatments or procedures? Are we doing it with the intent to minimize lost instruction time? You have a kiddo we just have a kiddo who has an eating disorder and parent wants him removed from class 10 minutes before lunch to eat by himself. Well, 10 minutes doesn't sound like much, but 10 minutes a day times 5 days a week is now he's lost an hour of instruction time. And over the course of the entire year, this poor kiddo is losing instruction time when we know evidence-based information that it's healthy and important for him to be eating with his peers. So our goal is intentional scheduling, minimizing lost instruction time, removing that health barrier regardless of what the condition is. And you will see improved self-care. You will see improved attendance. And I am telling you, you are going to see improved academic achievement within your district. You will see those test scores start going up. And as we are seeing as well, I know that the Department of Education contacted Dr. Bob, and one of the questions asked is, why is West Ada seeing these market increases and jumps in academic performance? And made my heart sing. He said it's school nurses understanding how important being in the classroom is to academic success, and everybody working to make sure our kids are healthy, safe, and ready to learn. So We're doing a great job, you guys. Just keep going. If you haven't seen the gains, you're going to start seeing them. Here's another quick slide about removal of health barriers. Next slide. This is the kiddos on the soccer field, Jocelyn. And you'll see this slide used in education in a multitude of ways, but looking at it here, the first slide shows no individualized healthcare plan, no coordination of care. Your little kiddo at the end, he can't participate in the activities on the field or see what's happening. When you implement a blanket health plan that may include some individualized nursing interventions, but are just this broad list of here's all the interventions to deal with the kiddo with X, Y, and Z diagnosis, you get the boxes that let them get up and see, but you're still not removing the health barrier. The final picture is a good depiction of that care coordination with educators and the healthcare team that create individualized healthcare plans that are appropriate for the student and appropriate for where that student is in the school setting. We all have different school cultures. We all have different school settings. It is not fair to expect our physicians or community partners to understand what that looks like at our school for a student with a particular condition. We have to be and take on that role as the care coordinator to explain that. I know even at West Ada, we have different schools and programs that if you have a student with a mental health condition, does the provider know that they're in an alternative education setting? If they're in a particular classroom, do they know what that classroom looks like? Again, it's so valuable and important to removing those barriers. Slide 16, another quote from NASN that's valuable and important to this. Professionals in the school setting with education expertise and experience to design plans to mitigate health-related barriers to learning, provide for continuity of care, prioritize needs, and facilitate accessibility for students with disabilities and to address other barriers. It's all over in the book. Lots of quotes. Key points again today. I invite you. Last year we talked about the role of the school nurse. Randy at Harms, American Falls School District, and I talked about the role of the school nurse and invited you to follow the rest of these educational series looking through that lens. This time I ask you to listen to what the providers are telling you and teaching you and look through that care coordination lens of applying it and bringing it back to individual students within your own schools or districts that have these particular conditions and what makes it unique to them and what kind of conversation or care coordination could you be having that would be really beneficial for that student. So today I hope you learned to understand care coordination using the school nursing scope and standards of practice from NASN's framework, that you are able to articulate the role in collaboration and coordination of health and learning, and that you can articulate the school nurse role in collaborating with our community health partners, calling up Casey or Noreen and saying, hey, I'm calling you up, I'm the school nurse, and I want to make sure Johnny's insert whatever health condition is effectively managed while he's here at school. He'll be in a class and learning just like his peers. It's really important that we get him to that place. And Johnny's with us every day, 6 hours a day. So we're hoping to provide you with some valuable insights and information on what may be working or not working with this current medical plan in the educational environment and how we can tweak some of these interventions to best suit Johnny. So make it a habit of calling your providers, just saying, hey, I'm the school nurse, want to introduce myself, let's collaborate on our kids. And that's kind of that last bullet, that you will begin to articulate your role with your community health partners by reaching out, and then you'll develop individualized healthcare plans that focus on removing the health barrier and, again, advancing academic success. And remember, academic success looks different for different kids. And so with developmentally delayed kids, it may not be that they're excelling in math or trig, but they're going to excel where they are growth and development, and be able to gain what educational advancements are pertinent to them. And again, remember, when we're talking about collaboration with medical providers, we're including parents. So references, everything that I talked about today came out of, even the quotes, the National Association of School Nurses Scopes and Standards of Practice. And I just want to, I'm all about tying things back in and closing the loops. So quote, or slide 19 was from last year when we talked about standards of practice and the role of the school nurse. This was a slide that Randy, the superintendent at American Falls, put together of what the role of his school nurse participated in. And I just tweaked it a little bit based on what we've learned today about coordination of care to show you some of those differences between our system standards of practice and our coordination of care, which is about individuals, and broke it out. So developing health plans for a particular student with diabetes in a particular setting, and participating in 504s and IEPs with the intent to implement meaningful academic accommodations specific to students. Pet peeve of mine, and people know this, I don't like standard accommodations. Example, student with ADHD, provide fidget, provide ability to stand and rock, whatever. You have to know what that individual student's ADHD looks like and how it manifests itself, so that you can write an accommodation that's specific for that kid, rather than giving them the blanket accommodations that we can all come up with. Next slide, last slide, is the school nursing, some more items that Randy had outlined about the school nurse's role that I think are really valuable, and that we tie it back in and look at it, but start looking at things through the lens of, again, what's that system process and standards of practice versus what's the care coordination that deals with the individual's specific needs. So that's it today. Again, you're doing amazing work. You are amazing in rural Idaho with the resources that you have. We are incredibly lucky in Idaho to have the nurses that we have in our rural communities. And I hope that some of this education just brings some additional information and knowledge for you as you go forth.
Thank you, Tracey. That was amazing. And I had a lot of points, but every time I thought of a point, you brought it up. So, but I do want to emphasize one of your last points, which is the importance of communication, direct communication between the school personnel, usually, you know, the health professional, that is the school nurse, and the medical home, or at least the primary care provider of the student. Because, you know, if sometimes things can get lost in translation if everything goes through the family. So the family tells the school nurse, this is what the doctor said. And then they go to us and they say, this is what the school says. And that can sometimes be fraught with problems. And so my question for you, I actually have a question in here, Tracey, is when in your process, in your day-to-day practice, when do you decide that a student's illness or medical condition, mental health condition rises to the level of, oh, I need to make sure I get a release of information from these parents so that I can speak directly to their primary care provider? or
Yeah,
healthcare.
great question. And thanks for highlighting again the importance and value of communicating with care providers. I have found in my own practice, but also have seen it come up multiple times, that if we wait until there's a problem to get that authorization for exchange of info, sometimes we end up not getting it. And so we try to make it a standard of practice at the onset of the school year, before kids have begun school, to contact parents. And when we're getting that updated health history, consent for treatment, and new consent for medications, if there are any, of getting that authorization for release of information for that very reason, so that we can start the school year off on the right foot with the removal of the barrier. And a lot of times parents are more apt, those difficult ones that maybe have some reservation for whatever reason to give us that, tend to work with us at the beginning of the school year before school starts. So we try to build it in, and I encourage people to build it in to your practice so you have it already there. And identify your kiddos, those that have run a report or look at your students who has chronic medical conditions that periodically you know that you'll need that care coordination, and get that authorization so you have it on hand. Does that answer your question? And it's encouraging and trying to do that before school even starts. Again, the goal is to remove the health barriers. So what can we do and put in place so our kiddos with diabetes or severe allergies or asthma or whatever mental health condition are starting on the same foot as their peers day one? So that's my recommendation and what I see to be most effective. Do you have any thoughts?
I'd just like to say, sometimes I know there's an ROI on file, and the first person that you talk to may say, we can't give you that information. So I don't know what the standard is for, I'm sure each school has different methods, but just making sure that the ROI is put in a place where all staff have access to it so that everybody's on the same page.
Great point. Thank you. Any other questions?
Okay, great. Well, Maureen, go ahead.
Thanks, Tracy. That was really clear and thorough. I just wanted to ask about, and this is probably for the providers out there, what the optimal time to have that transition meeting is. Typically, we'd like to be involved before the kid returns to school. Like if they're being discharged, we want to have transition meeting before they show up at school in case there's anything we need to put in place. So maybe if one of the providers could speak to that, or Tracy.
Tracy, you want to take the first stab at that, and then I'll follow up.
Okay. Yes. Ideally, I think it's making sure parent knows, or as soon as we know that the student's inpatient, regardless of the reason, that we say it's really important that we schedule a transition meeting. And I think also letting parents or inpatient know who are those key stakeholders that should be at the meeting. I think sometimes we forget that and we get one person going to the meeting, but I think the ideal time, as you've said, Maureen, is before they're discharged and before they show up at school. Once they've showed up at school, we're again behind the clock, and now we're trying to figure out what's the best way to remove that health barrier and get them back to academics.
Yes, in the ideal world, it actually comes up in terms of school accommodations at the time of discharge when the student is still in the hospital. There's typically a discharge coordinator who's actively thinking about things like, does this child need school accommodations? Again, I think the problem is there might be even a plan for school, but it's not necessarily communicated to you guys. And if that's what happens, because I think what you're asking is a lot of or what you're saying in between the lines is a lot of times the child comes to school and they've already been discharged and they're there, but they need these accommodations, but you haven't had that meeting because the medical providers didn't give you the information beforehand. Yes, that absolutely does happen, unfortunately. That is a good time to get that release of information from the parents so that you can have a conversation with the healthcare folks that discharge them or the primary care provider. And I don't know if that answered your question, but I think
Is
Dr.
that
Peterson
something that the discharge coordinator then needs to be? I mean, because we have a release maybe with you, but we don't have the contact with the discharge coordinator that, at least for myself, I don't know who the discharge coordinator is on any particular case. So how do we go about making sure they know that we need to be in the loop before?
Yeah, that
Yep. How's that take place?
I can make sure, so they have regular meetings too, and make sure that that doesn't fall off their radar. But unfortunately, you will be having to catch up. If you see a student come and they have a plan for accommodations, but you haven't had any kind of meeting or communication with the provider, then it's not going to be the discharge care coordinator anymore. It's going to be that patient's primary care provider. So I don't think you're going to have that discharge care coordinator as one of your contacts, just the primary care provider at that point. But I can certainly let people know that that might be falling in the cracks where schools absolutely need to be notified, especially when there's accommodations that are being asked for.
Casey, do you want to add? Oh, go
Yeah, I
ahead.
do. I think from a mental health standpoint or psychiatric standpoint, there are some differences as well. So, like on inpatient psychiatric units, we have lots of kind of care coordination that takes place or happens prior to a kiddo being discharged. We call them family meetings or coordination meetings. And so I think probably the best thing to do would be to loop in or somehow have parents be a facilitator to some extent, like, oh yeah, my kiddo's inpatient, if we know that, and then the parents can help request that schools or nurses or whomever be able to participate or allowed to participate in those meetings, because in them undoubtedly you're talking about home accommodations, you're talking about school accommodations, and the like. And then there's the more extended treatment, like residential treatment, where kids are in treatment for somewhere between 6, 9, 12 months. And in those settings, they're usually doing some form of school or academics. And so I do think it's really important to help bridge that. And so I do wonder if parents are going to be a key to helping communicate between those two entities, because you're not always going to know what facility they're at, who that person is to contact, whether or not we have a release of information signed. But I think the concept or the idea of having enhanced communication in those environments helps. So, I mean, I can help facilitate that for places here in the Valley, like Idaho Youth Ranch or Cottonwood Creek or Intermountain Healthcare. But when we extend beyond that scope, I don't even have those relationships. And so it might be a little bit more difficult, but I think the concept or the idea makes a ton of sense. And I think there's a lot of value to it. And there's one more thing I'll add, and that's the PHP program. So our partial hospitalization program, when kiddos are in hospitals for somewhere between 4 and 6 weeks, and it's just day treatment. So they're there from about 8 in the morning till 3 in the afternoon. And I know Chris, who's our school teacher at PHP, really works hard communicating with the kiddo schools. And so if you have the opportunity to interact with her, she is great and I think really informative and stays on top of things pretty well.
Thank you. Thanks, both of you, all three of you.
Okay, yes, thank you so much. Okay, so we still have time for our measles related questions. So we're going to transition to that. I'm just going to stay silent here for a bit and see if anyone has any questions for us.
Nobody's laughing at me. I was scratching my measles.
While we're waiting for questions, I would encourage folks to look at that measles webinar that was done, mainly Dr. Christine Hahn did a fantastic job with just coming up with a plan. And that was one of her last slides was that each individual district or school needs to come up with a plan for when or if, hopefully, there's a measles outbreak. And I know from some individual communication with some school nurses that there are already some of you out there that are creating plans or toolkits in preparation for measles outbreaks. And so I'm hoping that if someone comes up with a good one, it's something that they can share, but definitely something to think about because a lot of the a lot of this is going to depend on preparation. Unlike COVID, we know a lot about measles. And so you can already start informing both your parents and the school personnel what is measles, what it's not, what a measles outbreak might look like if it happened in the school, why we exclude, when we exclude, why we need to have certain types of information, like if somebody's under immunized or if someone's immunocompromised. So starting before an outbreak is definitely the way to go.
Looks like we do have some questions coming in. Someone, and I'm not sure if you know this, and I can send this to Dr. Hahn if you don't. Any scuttle if there will be wastewater tracking, is that possible?
There already is wastewater tracking for measles in the state of Idaho. In fact, that's how it was actually in the wastewater where measles was first identified in northern Idaho. In the county, 2 counties in northern Idaho was from wastewater, even before the first positive case came up. And so Dr. Hahn and her team already knew that there might be some positives. So yes, that is possible and it is happening. Hopefully that answered the question. If it didn't, please ask a follow-up. And then Tasha, can you speak to the new recommendations regarding splitting the MMR and varicella vaccine and implementing only recommendation for the second? You know, this is actually the splitting the MMR the measles, mumps, rubella, and the varicella vaccine for the first dose is actually not a new recommendation, simply because when you give ProQuad or the MMR and varicella vaccine together, it actually does lead to increased side effect of fever. And so for a lot of us pediatricians, we already do that with the first dose, which is usually given between 12 and 15 months. So for a lot of us, it hasn't been a big transition, if that makes any sense. So usually we'll do MMR and varicella separate for the first dose, and then the second dose, usually the 4 to 6 years of age, it is ProQuad or the combined MMR and varicella vaccine.
Perfect. Are there any other questions? And if you want, if we wait, as we wait for other questions, maybe talking a little bit about some strategies for collaboration. Like we just talked about that here a little bit, but between school nurses and or school staff and medical providers, if like there's a measles outbreak, for example.
That's a good question. So again, I think preparation is key. I think as the highest level of medical professionals in schools, I think it is in the purview, let me know if I'm wrong, but it is in the purview of school nurses to start the conversations with their school's leadership and administration and what it would look like if there were an outbreak and what those lines of communication would be. And it usually isn't with a medical provider directly. It's usually with their health district, correct? So already having those open lines of communication with Central District Health if you're in Boise, Southwest District Health if you're in Canyon County, so that you already know who to call, who to email, because when there's an outbreak, since measles is highly contagious, things need to happen within a day. You know, you have to report within a day. You need to be thinking about those children who are vulnerable to measles for whatever reason, and contacting those parents just in case, like within a day or two. And so, and it's going to look different in the rural areas than it does in Boise. And so, honestly, just thinking about what it looks like, going to the CDC measles toolkit for schools on their website is a good place to start. And obviously, you can always reach out to one of us here at Project Echo.
Yeah, and I'll just add, if I may, that your local health districts, call them now, and they'll come to you at the school and see what your plan is and take a look at it and provide you with some feedback. Our local health district did that last spring, and gave some feedback as to the appropriateness of the existing plan. In response to not just measles, but any communicable disease outbreak and where we're at. So invite your local health district over too. Have them come over and sit down and say, this is our plan. We provide me with some feedback, and they'll probably provide you with some resources and tools too.
Okay, that's great. Any other questions, comments, concerns that you want to vent about?
I would like to hear if anyone out there has started thinking about this and what they've done in preparation, just get an idea of what folks are doing.
I'll speak up. My name is Christina Class. I'm not
you.
on camera. Can you hear me? So I coordinate our school health program through St. Alphonsus. We support the Treasure Valley Catholic Schools. And we've just taken some preliminary steps with just, creating lists of at-risk students, those who would maybe be non-vaccinated or have contraindications for whatever reason. So we have that, at our fingertips in case of an emergency or an outbreak, I guess. And then we've done some of that just groundwork in terms of communicating with our administrators. So they have the toolkit. They know what's coming. But there's a little bit of sensitivity around what we communicate to families. And I guess I would be looking for a little bit of guidance on that, of what the best way to communicate to families at this point, and what level of information would be best for them.
Again, it's going to be up to your individual, your leadership, but I think it would be very appropriate to send out something now about what measles is, we used to have a lot of it, and now it's coming back, and what to look for. There's a lot of good CDC handouts on measles that are very general like that. And so if you send that out, it gets people thinking about it. Maybe people who are on the fence of getting immunized for it might get immunized for it when they learn that, for instance, measles has no treatment whatsoever, that really the only good way to protect your children is the vaccine, and that, more than 10% of children with measles end up in the hospital. Just giving them that information, because once there's a measles outbreak, then you're going to get all of these questions. They're going to be maybe looking at websites that may not have correct information. So I think that's a good first start, is, asking, hey, can we send this out to parents, because it might happen this year.
That's helpful. Thank you.
Okay, well, we are at the end of the session, so thank you so much for everyone, and for the suggestions that are in the chat. Some people were talking about, like, at the Boise School District, they created a preparation toolkit with newsletter tidbits, talking points for families, checklists, some CDH and CDC links, things like that. So Great job. Thank you so much.